I was diagnosed with chronic hypoparathyroidism when I was 15 years old. So that was in 1988. That was some 34 years ago. My understanding of hyperpara and the symptoms of really, I've only come to learn in the last 10 years. So as a teenager, I'd think I'd have psychosis, or I knew my brain would not work or function properly. But not only that, I used to suffer terribly with my tongue. I couldn't physically talk. There were times where my tongue would just spasm, and it was really frightening. And I didn't know what was going on. I didn't even know that it was low calcium. So it wasn't until I'd go for my routine endocrine appointments, which at the time were annually, and they would realise my medication dose was not sufficient, or I needed to increase this or increase that. I would just have to live with it, but not knowing what was wrong. I guess by just taking my regular calcium, it was kind of just keeping me afloat. But I would have periods where I would drop. It's like a sensation where you're just falling. It's strange, but there wasn't anywhere to go to, no one to talk to, because no one understood. And I know there's lack of knowledge within the medical field now, but generally in the vast population, you mentioned hyperpara, no one's heard of it. The kidney problems really started probably 20 years after diagnosis. So yes, for me, my ideal treatment would be parathyroid hormone, the missing hormone. So, and it's more widely understood now that parathyroid hormone plays a much greater part than just regulating calcium or regulating blood calcium, but there's PTH receptors in the whole body, in the brain. And also having parathyroid hormone will help the kidneys do their job properly, retain the calcium. And because at the moment my urinary calcium is very, very high. I know that.